Some better news out of Dallas this morning. The quarantine period has now ended for those who had initial exposure to Thomas Eric Duncan, the Liberian man who became the nation's first Ebola fatality. In all, 44 people and their 3 weeks of monitoring, including Duncan's fiance and her family. Joining me now to talk about this is Dr. Devi. Did I
Yeah, you got it. You got it.
She goes, oh, you can just call me Dr. Devi. And I didn't. She's an assistant professor at New York University. Thank you so much for being with me. So I want to ask you first about Duncan's fiance and her family, totally cleared. It's amazing to me that she and her family never contracted Ebola, but these nurses did.
Exactly. I think there are a lot of mixed messages because, we're talking about how people need all this gear, these hazmat suits and stuff to be near these patients, but then at the same time, they didn't have any of that. So I think, it depends on two different things. Early on in the disease, you may have symptoms, you may have bodily fluids and stuff, but you may not have as much virus in the bodily fluids. So, in terms of how likely a person is to get the infection, it may be a lot lower risk. And then the second part is, in terms of the body fluids you're exposed to, if you're in an apartment or a home, most likely you might see vomit, diarrhea, maybe tears, saliva. But in the hospital setting, there's so many procedures that are done to people to keep them alive in terms of the blood loss, the urine, just all of the stuff. It's a lot more in terms of secretions than you do in the home.
So as you get closer to death as an Ebola patient, the virus in your body skyrockets.
Exactly, the amount of virus in your body, because it's taking hold, it's reproducing in your body to be able to get what it needs.
Geez. Okay, well, let's talk now about Amber Vincent. She's one of the nurses who has Ebola now. She's the one that got on the plane and went to Cleveland, planned her wedding with her mom, right?
Yeah.
Well, her family has now hired a lawyer because they feel that Amber Vincent is being vilified, even though she called the CDC twice to ask if she would be able to fly, and they told her, sure, go ahead.
Yeah.
So is she being vilified? Is this fair?
I don't know that it's fair because she's a hero, right? I mean, she risked her life to be able to try to help this patient, a stranger who she didn't know. And then on top of that, I think that we should talk to healthcare providers and have really kind of a contract or a consent, not a legal contract, but something that shows you're not just risking your own life, you're risking your family's lives, your loved ones, because if you get it, the people that you're in contact with are at risk, and you're risking your reputation. Realistically, all of these people, even Thomas Eric Duncan, he got Ebola because he was trying to help a pregnant woman by taking her to the hospital. So, even though he's also been vilified, he actually did have really good intentions of trying to help somebody in the first place.
But it's interesting because no one on the plane with him got Ebola.
Exactly. So
These
I think it's the same thing. Yeah.
Got Ebola.
Exactly.
Okay. I just want people to keep this in mind because I think there's a sense of hysteria out there.
It's true.
I mean, like they're closing schools and they wanted to burn the bridal dresses in the bridal shop where Amber Vincent shopped for her, her wedding gown.
Yeah, and I think, again, it's the mixed messages with the hazmat suits because if you think about it, even the people traveling, there was one person who traveled to Nigeria on a plane from Liberia, nobody around him actually got Ebola either. So it seems like it really is very difficult to contract in terms of the body fluids, but these healthcare workers, especially the ones in the ICU setting, are at much more risk.
Okay, let's talk about the 21-day quarantine because many lawmakers have come forward and say, look, it should be 42 days because according to the WHO, it should be 42 days, except the WHO says 42 days is for a country to say it's clear of Ebola, not a person.
Exactly. Well, there's a couple different things. So the WHO published a study in the New England Journal of Medicine, which is our major medical journal. And in that study, they said there were a few people, like a handful of people, who might have contracted Ebola outside of that 21-day period. Now, they didn't explain how they came up with those days. It could be that they actually saw people and they had a clear timeline. Like with these cases in the U.S., we know exactly when these nurses were exposed. Not the moment, but the day-long period when they came into contact with Duncan. But in West Africa, we don't know for sure, are they actually creating a timeline or was this sort of they saw people who survived and asked them, hey, when do you think you might have been exposed and let's kind of come up with a number from there. So it's really important to go back, track these people and find out where did these numbers come from in the first place because it's a really big deal. We have to be sure about our decision.
Okay, final question is about a travel ban. A lot of lawmakers want, nobody flying from West Africa to the United States. No, no, no. Nigeria just declared itself free of Ebola. free. No one's contracted a case in 40-some days, 40-plus days. It never sealed its borders, and it never instituted a travel ban. So what does that say?
Well, so I think there are compelling arguments on both sides. But again, here too, I think we could use a little bit more information. I mean, who's traveling back and forth to the U.S.? If it's American citizens and they're returning back here, I think, it's reasonable. They have to come back in. But if it's people who, if it's tourism, I think that's something that's not essential, as opposed to if it's humanitarian aid, well, we want those people to be able to get there. And the other thing is, if we could bring some Ebola survivors here, I think that would be reasonable to do, because they can't get Ebola again. They could help us with our healthcare workers. They could actually treat some of the patients that we have here, because they can never get Ebola again.
Oh, that's interesting.
They could help with research too. I mean, if they were willing, we could study their blood to find out what is different about these folks, what allowed them to beat Ebola.
Okay, I lied. Final question. In the end, when all this is over,
Yes.
and it will be over soon, and it will be, what will we have learned?
Well, it's hard to say, because any kind of tragedy, it's hard to look at it from a positive point of view, but at least hopefully it'll prepare us for any future outbreaks, and working with other countries and communities to try to figure out how can we address problems like this before they get to this level. So.
Dr. Devi, thanks so much. I appreciate it.